Hi, my name is Dea. I was raped by my doctor and several members of his staff. So, yeah, this whole thing that happened to me was kind of something that had happened to me before, but in like the most extreme sense possible. Like this was like the sexual assault experience that just like broke me. Like I'd been through a lot of things before, and I think, well, we know that's why he chose myself and at least one of the other victims that wanted to come forward. So essentially, like, he sent this woman named Tracy to act as a sort of therapist in, at his practice. And, she was like very focused on my trauma history, which I thought was, like it's normal, but she was like very, how should I say, morbidly curious about like details that I'd never experienced with other therapists before. And weirdly enough, like the only reason that I saw her was because Leng Ky, the guy who, raped all of us, basically asked me out of the blue, out of nowhere during a checkup, whether or not I had ever been raped before. And I was like taken aback, and I was like, well, yeah. I don't know why I even answered him honestly, but I just like, I don't know, like he just caught me off guard.
So he was your doctor?
He was my pain management doctor. Yeah. Got the best pain management doctor I'd ever had.
Okay. And how long were you seeing him?
About, I think like a year and a half at that point.
And it was a year and a half in that he asked you the rape question?
Yes.
Okay.
Yeah, it was fairly close towards the time where I think he was like testing boundaries with me to see if I would be, like a good enough, mark for him.
Okay. And then he had this woman reach out to you.
Yeah.
For like therapy reasons.
Right. Like he was like, oh, I'm expanding my practice, to have these therapists who work, there's like a mind-body connection between, sexual assault and pain and which is true, like that was something he knows that I'm really into like reading studies and things like that. So like, he even offered, to show me the studies or whatever. But like I said, I'd already known about it. So it didn't like ring as many alarm bells as it normally would. I just thought like he was like, I don't know, reading my body language or something and able to tell that it might be something that I needed. I don't know. I pretty much through any interaction that I had with him that was inappropriate, like my mind did kind of like somersaults to be like, no, because, he's someone who's there to help me, like he's in a position of like authority. And I guess it was like too much to consider that, yeah. So yeah, like basically like I ended up seeing two of his quote unquote therapists, another woman, she went by Sonia Ulrich, and she actually wasn't even a therapist. She was supposed to be, supervised by an actual therapist. Like she was still getting her hours in, I believe. So she was in absolutely no position to be giving therapy, and even less so to someone like me who've had like a very like serious trauma history. So I thought it was very strange. And she had something that she called touch therapy, where she would like stroke you to like make you like, stroke your body gently. Like, I don't know. It was really weird. And when she was telling me about it, I was like, I don't want that. Do not touch me. Please don't do that under any circumstance.
Yeah.
And she was like, well, it works really well with my other autistic patients. And I'm like, that's great. That's great for them. I just don't do it. So we'll put a pin in that because that comes into play later.
Okay.
And so like, yeah, so Tracy was extracting all of this information about me. Like she, like was asking me about my childhood and things like that. And, she would like grin in this like really weird way, but like, I'm neurodivergent. So it like took me retrospectively to realize what it was that she was doing. But I did notice that like, it was an unusual reaction for somebody to have. And yeah, she would like, she basically like did something very strange that that came into play later when we went to court and everything like that. But she waved aside some of my like early childhood sexual assault experiences, and even the pedophile boyfriend I had when I was 14, she hand waved that away as well. Actually, wait, no, I'm sorry, I was 12 at that time, so even younger. He was my first boyfriend, and she was like, "Oh, that's that's just like how it is. All young girls want to date somebody who's older to seem cool or whatever." And I'm like, "Okay, that that doesn't make it normal or right or good. It's a horrible thing to say." And when I was like a little kid, one of the neighbors, like cousins or friends or whatever, an older kid. He sexually assaulted me, and when I told her about that, she basically boys are just gonna be boys me about it, and I'm like,
So do you think that this pain management doctor, his name's Dr. Leng?
Dr. Leng Ky, yes.
Dr. Leng Ky, okay. So you think that he hired these women to basically get more information?
That is correct.
Okay.
They were also in a relationship with him in which they were doing this in exchange for painkillers. That was how he pretty much got anybody in his practice to do what he wanted, is, finding people who liked taking painkillers recreationally, I guess, and, basically got them to do his bidding. Because while he was assaulting me, I can't speak for the other girls, but when he was assaulting me, he had Tracy Chester go out and like patrol the parking lot and look for my mom. And my mom thought it was really strange because it was a Saturday. She wasn't supposed to be working, and she was just going out and like scanning the parking lot. And I don't think that she realized that, my mom was using our other car that day. So she didn't even notice my mom was there. Yeah. It definitely was that. And the other guy who was assaulting me, Isaiah Torres, as far as I know, he doesn't even have his medical license, and he was acting as a nurse essentially. Which is terrifying.
Yeah.
He's actually in nursing school, the School of the Rockies or something like that right now, and he's living his best life. So he was another person who had actually been working with Leng Ky for years before any of this happened. So it's like really harrowing to think just how many people it was, because like more people than anybody could count came forward. They just didn't want to be part of the legal proceedings, which I totally understand. It was a lot to deal with.
And how long was this doctor in practice for, like total? Do you know?
I don't know, but I do know that one of the other girls, I mean, it was like a decade ago that he did it. So I don't think that he had like a resting period in between any of that. Like he was working at multiple hospitals, many of them with like elderly patients and stuff like that too, which is just like, yeah. Right. He has no hesitation about like who it is. It's pretty much like anybody who's vulnerable, anybody he's attracted to or not attracted to or whatever, anyone he could get in that vulnerable position.
Do you think it was boys and girls or just?
No, it was just women.
Okay.
Yeah. As far as we know.
Okay.
But it didn't matter what kind of woman or girl, if they were a minor or not, like he really did not care at all.
And how old were you at this time?
Oh, this was only 3 years ago.
Okay. So it's recent.
Yes.
Okay.
Yes. But one of the other victims, like I think she was like a minor at the time, and she's still very young. She looks like a baby. So it was, it's just frightening because there are a lot of kids who need pain management and, need to go under anesthesia and things like that. And, they're even less likely to like understand what happened, because after it happened, I actually reported it to Tracy, and she told me, that I had a trauma hallucination, and I was like, never heard of this before.
Yeah.
Never happened before, but now it's randomly happening to me. So I was like, whatever. I initially thought that she was going to like help me report it legally, but it ended up going much, much differently than that when I actually showed up. I ended up getting attacked by the doctor and Sonia that time for, I think, 2 hours, something like that. Would you like me to explain that?
Yes, please. Yeah. And also, before you go into that,
okay,
what was your pain management? Like, what was that?
So I have scleroderma, Ehlers-Danlos syndrome, and fibromyalgia. I also have torn bulging and torn bulging and compressed discs in my my lumbar, as well as between the spine between my shoulder blades. There's rheumatoid arthritis and stuff that is a result of the autoimmune issues. So there's a lot going on. Like, I really needed to see him and have a competent doctor who understood these issues.
Right.
And he was.
Okay.
Yeah.
All right. So tell us what happened.
So, with the initial assault, I was supposed to go in for what's called a radiofrequency ablation. And a radiofrequency ablation is essentially where it's usually like a 30-minute procedure if it's one location. And you go in, for someone like me, we're put like in a semi-twilight state where I can still respond and things like that. But I'm not like freaking out about the pain, because normally you don't need anything for it. But for special patients like myself, you have to like sedate me a little bit because of the muscle tension that happens involuntarily. So you basically, you go in, you get your anesthesia, they stick a needle in your back and burn off, the nerves that are there, every 6 months or so until they grow back. And it helps significantly with pain. So I went in to get one of those, as I had done many times before with him. And it was just already a really weird vibe when I pulled up, and I have no idea how I knew this, but I just like told my mom, I was like, I need you to like come in with me, like something, I don't know. I need you to come in with me. And for some reason, like I just started crying, and I don't know, something in me just like felt something was wrong, and I'll never doubt that feeling again. But yeah, and she was just like, whatever, you've done this a million times before, you'll be fine, blah, blah, blah. So I went in, and first thing I noticed is that there are no other patients there, like no one. There are 2 people behind the counter, one female nurse and Isaiah. And he sends the female nurse away, which, I didn't think anything of at the time. I was like, okay, she's going on a lunch or whatever. And I didn't see Tracy, by the way, at this point. I didn't even know she was there. So Isaiah was there, and he handed me the tablet so that I could check in. And the way that he was looking at me was like, it made me very uncomfortable, but I checked in, I did my thing, I gave it back to him. And usually they like, input the information and like finish checking in and stuff before I get back there. But he just like took me back instantly. And I was like, okay, which was unusual for this practice, which we'll find out why later. But so I go in and I sit down, and Isaiah, he's like acting like he's inputting a lot more information than he actually is, because the whole time he's just staring at me like this. And he's got this kind of like weird, like, I don't know, like animal kind of like grin that he's like trying to like maintain. And he was just being so strange. And the way that he was moving around me when he took my blood pressure was like, he was like prowling around me, and I was like, whatever. I didn't think much of that, because, legally speaking, that female nurse was supposed to be in the room with me when I was getting the ablation. So to my knowledge, she wasn't far away. She would be right back, it had never happened before otherwise, right? So, and Dr. Leng Ky, after my blood pressure cuff was off, he was just in like that. And he already had an IV in his hand. Like, he didn't even wipe off my arm or anything. I was just sitting in the chair. He came up to me, started sticking, grabbed my arm. He's like, we got to give you an IV. And I'm like, well, what's going on? Why do I need an IV this time? Why am I not just getting an intramuscular shot? And he was like, well, it seemed like you were having a bad reaction last time. And, for legal reasons, I just want to make sure that, you're going to be okay. And, if we need to give you something to wake you up or whatever, we can. I was like, okay. And at this point, like I trusted him, I had no reason not to. And, I was unconscious basically before I even got up and hit the table. Like I have like a very like blurred memory of even getting up. Like he basically like stuck the IV in and then started pushing. Like he had everything just like ready. And the next thing I knew, I woke up and, his man bits were in my face, and I was, lying down on the table and my pants were pulled down, and, my anus was screaming in agony. And I just remember saying like, no, I don't want to do any more sexual stuff. Stop. I don't want to do it. And I looked behind me, and Isaiah was standing behind me, and Leng I just hear like this like echo of Leng being like, get her down, like da 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 da. And the next thing after that is me, hearing my mom being like, what the fuck did you do? What did you do? Why are they like this? What did you do? And, basically like Tracy and Isaiah helped take me to my car, and Dr. Leng Ky was nowhere to be seen. My mom was like, where is he? Like, da 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 da. Like, why are they so messed up? This is like, I should be able to like still have a full conversation with you, and the level of, anesthesia I should be under. There was no reason I should be like, just like a limp rag doll, with absolutely no ability to like speak. And, my mom had me in the car, and, we were sitting there for a long, long time until I could basically speak to her. And she was like, what happened? What happened? And I just started crying. And I said, I think Dr. Ky raped me. And she was like demanding we go to the police and stuff. But because of other experience I had in the past, I was like, I was terrified to go to the police and have to, I thought experience the humiliation of them like looking at somebody who looks like me or whatever, or has a mental health history like me, and just like hand waving me away. Because in my personal experience, that was pretty much what had happened before. So had another victim not gone to the police, I'm not sure anything would have happened.
Yeah. Which is unfortunate, and I feel like happens more times than not.
Yeah.
So you were obviously laying down on the bed. Yeah. And when you woke up, he was basically just like, it was just in your face.
Yeah. His half hard member was in my face. And and it was just like a quick blur. Like he didn't let me be up for very long.
And you were in pain in other areas.
Yes.
Okay.
Yeah. And my pants were pulled down like below my butt, so.
I mean, that other doctor or nurse, whatever, Isaiah, was just standing in there watching basically.
Oh no, he was behind me. He had been sodomizing me. Yeah. Yeah. He had been taking part in like the whole thing.
Okay.
Yeah. So.
And were any of the women nurses in there or no?
The female nurse was nowhere to be found. So we think that they just like sent her home, which like I have words to say to that nurse if she ever sees this, because she knows that it was her responsibility to be in that room. Right. So maybe they couldn't find anything on her, but I think that she was also being given painkillers, because that's just how he worked. I mean, like, and the messed up part is he didn't end up losing his license for raping countless people. Okay. Not at all. He lost his license because he was having sex with a patient and giving her painkillers like in exchange for sex, essentially. So that's a doozy. And that's like one of the reasons why I was like hesitant to go to the police initially, but once I realized that it wasn't just me being targeted, it's like I have a greater responsibility to do something about it, Yeah.
That's wild.
Yeah.
That is nuts. Okay, so your mom wanted to go to the police.
Yeah.
And did you end up doing that, or you chose not to?
So the first thing that I did actually was I contacted my therapist,
which was the Tracy woman.
So Tracy it was so strange. Weirdly enough, he told me, like I think it would be better for you to see this new therapist, Sonia. She's like better equipped to like. I don't know why he said it like this, handle people like you. And I was like, okay. I mean, I'll see her, and judge it out. I mean, like Tracy weirded me the hell out. So I was okay with seeing somebody else. And she was even weirder, if that's even possible. Very strange woman. She like spoke in a voice like this and like tried really hard to seem like she was like so soft and calm and like I love Reiki, type of lady, which I don't trust anybody like that. I'll be honest. Like they creep me out. So she was completely lackadaisical about her attitude about me telling her that my doctor raped me. She came up with this little, she and Tracy came up with this little trauma hallucination BS. And, essentially we're like, okay, come on down and we'll take care of this. So to me, that implied that we were going to be doing the right thing, reporting him to the board, reporting him to the police, you know, and I would have like my therapist there backing me up. So I felt comfortable doing that. You know, I was like, okay, cool. Like, it's not just my word against, you know, somebody in a much, you know, greater social position than I am. He has much higher social credit, I guess you could say. So I went in, and the first thing that I noticed again is that there are no patients there. Which, okay, you know, it was like, I think it was like a Sunday or a Saturday. I don't know. I don't even know if it was actually. They might have just like canceled all appointments. Anyway, there was no one there. Sonia calls me into her office. I go inside and I see that like her chair or her sofa or whatever that she normally sits in is like really, really close to the patient one. And I'm like, I'm just going to make sure I reiterate to her not to fucking touch me, man. Don't touch me. You know, in case she forgot. And so I go in there and, you know, she sits like really close to me, directly across from me. And she's just, you know, very, very intensely like, what happened? And, you know, I start explaining these things to her and blah, blah, blah. And, you know, she, like I said, started giving me this excuse about like, oh yeah, like it's normal for someone who's been raped before to have these trauma hallucinations, like yada, yada, yada. And I'm like, okay, well, I just don't believe that. I want to report him. Let's report him now. You know, like they can figure out what's going on once they investigate. So let's, you know, get this going on. And as I was like trying to explain, like, no, I've not had a trauma hallucination before. And no, it shouldn't have been happening to anyone. You know, she was like, you're hysterical right now. You're being hysterical. And I'm like, the way that she said it, she sounded absolutely nuts. She was like, you're hysterical right now. You are being hysterical. And I was like, I'm very certain I am not being hysterical right now, ma'am. Like, I'm very chill. And immediately, like, after I was like, you know, denying very calmly that I was not hysterical because I had like a mission in my mind, Dr. Leng Ky bursts in the door and he has a syringe in his hand. And I'm like, what the fuck? What is he doing here? What is he doing here? I'm like, and I start screaming at the top of my lungs, like, no, get away from me. And Sonia, she's right across from me. And normally I might have been able to like, you know, scramble my way out of there. But like, she just pounced on me and pushed me down, and Leng Ky injected me with whatever the hell was in that syringe. And I wake up in the fetal position in Sonia's lap, and she's like caressing me down from my hair, down like, you know, my legs, down my ass. And I'm just like, you know, like completely drugged. Like, what the hell happened? She's like, we had to drug you because, you know, you were completely hysterical. You were like a wild animal, and we, you know, and now you're safe. Now you're safe. Shh, you're safe. And I was like, ugh. Oh, like, get off of me. And I like got up and I was stumbling around. She's like, you need to come back here. You can't drive right now. And I was like, stay away from me. I was like,
did you drive yourself there?
I drove myself there. Just I didn't think that I was going to be under any influence at all. So,
do you think he did something to you?
Oh, absolutely. Both of them did. I was completely blacked out that time. He made sure he learned from his little oopsie that last time. I was the only person who woke up during anything. And it's because he forgot, I guess, that I take like extra anesthesia to go down for whatever reason.
How long, do you know how long you were blacked out for this time?
About like 2 hours. Yeah. Like, I mean, this conversation I had with her, I mean, it was like within like a matter of like 3 minutes or something. Wow. It was a very short amount of time before and I was so confused when she was like, you're hysterical. Cause I was like, what is happening right now? I was like, let's just go to the police. They're right down the street.
Yeah.
And like literally the police are like right around the street from where he did it. So like, I mean, he just feels like he can get away with absolutely everything. Mm-hmm. Yeah.
I cannot believe that.
Yeah. Yeah. And I can't believe that he thought that he could like do it again too. Like when I went in.
That's what I'm saying. Like the fact that it escalated to such a higher degree.
Yeah.
And obviously he was like ready.
Yeah. Yeah. And he could have killed me. Like ever since that happened and I had that, you know, like that series of druggings, I've had, you know, like issues with like my brain fog and things like that. Like I have like moments where I feel completely lucid. Like right now I'm feeling like, okay, but there are times where like I can't remember the beginning of my sentences, and I can't remember what I'm doing like all the time. Like I used to be like pretty sharp, pretty on top of my stuff in terms of, you know, remembering what I had to do that day or what date it was, you know. And then I have narcolepsy now too, on top of everything else. So like whatever he did really, really messed me up neurologically, and migraines. So I had just had 45 injections, you know, of Botox for my migraines. So yeah.
So after you tried to get up, were you able to leave, or they didn't let you leave yet?
I mean, she was like trying to like hold me back from leaving, and I was just like elbowing the hell out of her, and I was like, get the hell away from me. I don't think she wanted to play with me because I was like I was like snarling, like then I was like a wild animal, like get away from me.
What's sick too is like when you were acting calm and fine, they inject you, and now when you're actually like flipping out, they're like, okay, well, we're done doing what we needed to do.
Exactly. So. They're like, we're done with you. Get out. You know, you're just a little thing to us. You know, and the stories from the other girls are like just as harrowing. Like one of the girls, like, and I'm not sure anything would have happened, you know, had the other victim not recorded it. Like he had raped her multiple times, and I don't know if it happened to me multiple times. That's the problem, is that like
those are the times that you like know of.
Right.
Yeah.
So like, cause like the 2 radio frequency ablations I had before that, he was like, you know, oh, well, if you don't want to be in any pain at all, like, you know, I'll just give you a tiny bit more and you'll just have like a quick nap, and, you know, then.
So he was putting you under the other times as well.
2 times before that he did.
And you just didn't wake up during that time.
Correct. But like, to my knowledge, there were like other people there were other patients there.
Right.
But he had a way of this is what the police apparently said. They said that he would have a way of like convincing the staff members who were not in on it to just like go on their lunch, or, you know, go home early, or make some excuse. I need you to go get X, Y, and Z for me. Like it has to be done now. Like, and he just like, listening to the way that he spoke to his employees, like I just knew that he, you know, like that's very possible for him. Like when he was giving me my ablation one time, he was looking at that female nurse, the one that like was leaving. He was like, yeah. And he's like, okay, did I get the spot in your back? I was like, yep. I was like, it's in the right spot. And he's like, see, it's almost like I know what I'm doing. And he said that like 5 times during that procedure. And I was like, this is really obnoxious, man. Like, she gets it. Like, whatever she said, she gets it. Like, you know, but he just has this, like, really, I don't know, like, he just really looks down on people who aren't men, I think. He just doesn't think very much of them, which is terrifying because he has a daughter, he has little kids. And the whole time, he had a $5 million bail, by the way, because they didn't think he was going to stick around. Like, oh my gosh, my brain's farting right now. Anyway, it was like a huge sting operation, basically them getting him and keeping track of his doings and so on. But yeah, anyway, he was basically just like going to Hawaii with his kids. Like, I don't even know if you're allowed to do that when you're on bail or not. Like, maybe you can, but he was just living his best life. And he made an Instagram a Twitter account like on my birthday. Just so that he could, and his like little bio says like, don't believe everything you read about me. And he's like, oh, like it makes me want to strangle him. He was like posting things about like trans rights and things like that, and, you know, like Black Lives Matter, and, you know, like Me Too. That's right. Me Too. Especially that one really made me upset because it's like, he doesn't care about anyone. He doesn't care about anything. Like, he just lives for himself. Like he is not the kind of man who is capable of having actual empathy. Like, it's just all empty, you know? He only can feel sorry for himself. Like, he only feels sadness for himself, you know? Like, he was like trying to intimidate the witnesses when we first went into trial. He's not supposed to even be on the same damn floor as us until we're in that courtroom. And he came up like, you know, we're supposed to come in early, blah, blah, blah. We were all sitting together. He comes up with his sleazy lawyer and comes within like feet of us. And I'm like, get this man's away from me, or I'm going to bitch slap the dick out of him. He's going to be gone. Get him out of here. Like, get him out of here, or I'll get him out of here, basically. And they were like, okay. They took that very seriously because, like, you know, I didn't want to mess up the case, but like all of the girls started like sobbing and crying and like having panic attacks and shit. And he was just like, he was loving it. He was loving it. And I was just like, oh. So I stared at him in the eyes the entire time that I was testifying against him, because that's what he was doing to us. And he was like making the other witnesses like nervous wrecks, you know? And he was just like, so I was like, I'm just not gonna, you know, I'm not gonna break eye contact with him. Like, I just want him to know that like I will come for him, and, you know, we're not going to let this go. And he dragged it on for 3 whole years by switching attorneys over and over and over again. And I have no idea how he did this. His family has lots and lots of money. But he was able to get the judge to not, normally a judge is going to be like, no, stop. You've changed attorneys 3 times. Like, the trial is happening. That's, you know, you're wasting our time, you know, basically. Like, they don't have a lot of tolerance for, you know, if it's very obvious that they're just trying to stall the trial, which he was. So yeah, anyway, but he got it to go on for 3 whole years until we got another judge who was like, yeah, you can't do that.
Right.
Setting a date now.
So when you left there that other time and went home, did you tell your mom what happened?
Yes.
Okay.
I actually called her when I was on the way home. I had her on speakerphone, and she was like, what's wrong with you? She was like, why are you talking like that? Because I was like slurring my words, and like, but I was like so freaked out. Like, I shouldn't have driven. Don't get drugged and drive, kids. But like I was so freaked out about being anywhere. Get out of there. Yeah. Like, I just panicked. I was like shaking, like, and I was like, you know, like I dropped my keys like 5 times, like just trying to get into my own car, like thinking like, oh my God, like they're behind me. And I was like looking behind me. They didn't even come out. So like, I don't know.
So was it after that time that you decided that you were going to go forward?
Yes.
Okay.
So I was like preparing what I was going to say and what I was going to do. I don't think I was like ready to handle a rape kit situation. I think I was like, that was like just on another level. Like, it was like, they call that whole process the second rape for a reason, you know, like it's a lot. So, I wanted to like make sure that I, you know, I even saw him one last time after that just to see like, you know, how he would act. And he pretended like nothing had ever happened. Like, he just like refilled my medication, was like, okay, you know, that's it. You know, so I thought that was really interesting because he just assumed that I was, I guess, a fucking idiot. And it just was wiped from my mind forever. And, you know, everything was fine.
Or maybe
and
he thought that you were so vulnerable and naive and scared that you wouldn't say anything.
Right. And
or that nobody would believe you.
The really fucked part is that like I was on like a very, very low dose of like painkillers at that time. You know, my illness wasn't like quite as progressed as it is now. And when I started seeing him, he like insisted that I be on like these like monumental like doses, and he would like have these like long, like 30-minute long explanations as to why I should be doing it and yada yada. And you know, he just had a way about him that made it feel like, you know, he was really looking out for your best interests, and that like, you know, like he just wanted you to be comfortable. Like, he was like, everybody deserves to like live without pain. I'm a chronic pain patient. You know, that was like his whole like was that like he was a chronic pain patient. So he understood. And so he basically like knew that I would have to come in for at least one more med refill either way, you know, before I found another doctor. It's hard to find a pain management doctor who can like handle patients who are like as serious as I am. Cause like dealing with a patient who's on opiates, it's like, it's a lot. You got to deal with, you know, a lot of scrutiny, and like, you know, your license can be at risk if you don't do things like a very specific way. So like a lot of pain management doctors are just like, I don't bother. I just do ablations and, you know, trigger point injections and, you know, that kind of stuff. So, it was like all of us were like terrified of like ever leaving him because like, you know, it was like he basically had us and his staff that he had been like, I don't know if blackmail is the right word, but coercing into doing his bidding. Like, you know, it was, like I said, his whole MO was to make sure that people would have like as bad of withdrawals as possible and have to like come back to him if we just like stopped. Because even like tapering down from, he put me on this medication called Nucynta, and I've never been on a medication that's like gives you like such like violent withdrawals as that medication does. And it's not even like a real opiate, it's like a synthetic one. And he like insisted that I be on it. And yeah, so like if I didn't take it every 6 hours, I would like go into like full blown like shiver withdrawals, like my nose would be dripping. Like it was like I couldn't catch a break. Like I couldn't ever like skip a dose, you know, which had never been a problem for me before, you know, like, so yeah, like he wanted to get us like as badly dependent on him as humanly possible, which, you know, a lot of abusive people try and do that. Yeah. And you know, make you think that other doctors, like, instead of like, you know, like a regular domestic abuser separating you from your friends, like he would constantly try and like, you know, disparage the words of like other doctors and other people who might say like, why is he giving you so much? Like, that's like a lot. Like, you know, that's, I don't even think you need that much, like yada, yada, yada. And, you know, and he would just like have, you know, a very, calculated way of explaining everything away. And nowadays I wouldn't have fallen for any of that. You know, I know what it looks like now. You know, I know when somebody looks at you in that way that, you know, they're sizing you up, you know? Yeah. Yeah.
So you didn't want to do the rape kit?
No, so I was just trying to basically do the same thing as the patient who recorded him did, and like, you know, catch him, and I wanted to catch him, Sonia, and Tracy. And Isaiah. Isaiah's still out there, by the way, like I said, living his best life. So he didn't actually get sued. He didn't, you know, suffer any legal penalties, like nothing. And so, yeah, I didn't really want to. I just wasn't ready, I guess, to do that. Now, like I said, nowadays, like I've healed and, you know, moved on to the point where I could do it. But, you know, a few years prior, or well, maybe it was like 2 years prior to all of that, I had been raped by my ex-boyfriend. So like they also like leveraged that, you know, to like use against me, you know, in therapy and stuff. But
and the one patient that recorded him, I'm assuming she did it secretly, right?
Yes.
And then did she catch him raping her?
Yes.
Okay.
Yeah.
And she took it to the police?
She did.
Okay.
Yeah. So that thankfully
helped your case, obviously.
Right. Okay. I mean, I had already, by the time that she had turned in the video, I had already gone to the police. Were you the
first one that went to the police?
I was the second person who went to the police, because I think a week after I saw him, I called for like some other reason. I can't remember. And I was like, well, where is he? Like, why hasn't anyone in the office called me back? Like, why aren't you, like, why? It says that you guys are open. It's like a Wednesday. What's going on? And they told me that he was arrested. And I, like, my heart, like, I just wasn't processing. And I was like, for what? Because I guess I wanted them to like say it to like make it real to me, you know, because of all the gaslighting that I had gone through. And they wouldn't even say. In fact, they were very rude to me. And I thought that was really weird too. Yeah. Weird thing to say. Of course, people are going to be upset. Like, we're on serious opioid medications. Like, we have like, you know, all these like procedures we need to do so we can like live our life. A lot of people want to go to work and be with their kids and stuff. But so everyone was freaking out and calling them. And anyway, so once I found out he was arrested, I went down immediately. You know, like I think like at one point too, like I was just in kind of denial that like, you know, I was like, well, maybe I did have a trauma hallucination. And I remember talking to my friends and I was like, maybe I did, you know, like, right. Like, I've been through a lot. Like, maybe that is the thing that can happen. Like, I didn't really, you know, there's not really anything like specific to that I could find, you know, like but like, you know, I was like reaching for straws, like grasping at straws, like trying to figure out a way to like make it
justify
so that that like, you know, it couldn't possibly have happened. He was like my most beloved doctor. He was, you know, he was the guy who had my back, you know, the last year and a half as I got my life back together after my ex-boyfriend raped me. Like, I started going back to school. I had like a 4.0 GPA, but then that also started going downhill too. The more he started increasing my dose, you know, like I would go in. He was like, what's your pain level? I'll be like, like a 6 or 7, which is like normal for me. Like all the time I'm in just like agony. That's like nothing new. And, he would just be like, oh, time to up your dose. And, like, I don't know. I
think
just,
like you said, it like sounds like he made his patients so dependent on him.
Yeah, absolutely. And then when you're on those level of medications, like your ability to cognitively process things is impaired, you know? So like you're not like necessarily like connecting the dots the way that you normally would be. So that was another thing too, is that like, and it affects your memory a little bit too as well. So, and things kind of like, blur together. So it was hard for me to compartmentalize the fact that this man who seemed so invested in making sure that I could go back to school and like live a, normal-ish life, and I had absolutely zero compunctions and, and hesitation and just like assaulting me like I was like his like sex doll, worse than a sex doll, really, Don't even have to drug a sex doll. So yeah.
I like can't believe that happened. That is insane.
It's like I couldn't believe it happened. Like that's why I was like in denial about it. Right. And my friends were very gently like, "Dea, that's really dumb." They're like,
well, that's what I was going to say to you too. I feel like in situations like that, it's almost easier to make excuses.
Yeah.
Especially when you had other like him and then the other 2 women trying to make you feel like you were hallucinating it. Right. And it wasn't real. So like,
right.
And then on top of it, you are on medication.
Right.
And you were like put under. So you start to doubt yourself.
Right.
Which isn't fair either.
Right. And it's so like, it's like strange to think of it now, but like at the time, normally when you go to a practice where there's like multiple doctors, especially doctors who do like different things, like they've got, their own thing going on, like, so to even like remotely comprehend that they were all working together for the singular goal was like so mind-boggling to me that like every person there was out to get you.
It's twisted and it's sick. It's beyond sick.
It should be made into a movie. I mean, like
or a documentary, something of the sort.
Yeah. And because like I personally never want the world to forget what he did. Like he's been trying the whole like 3 years to like recultivate his image as like Mr. Family Man and this and that. And
that's all he can do.
Right. And who knows, I mean, apparently he was like father of the year or whatever, husband of the year, but like he was paying his patients to have sex with him with painkillers. So like, I don't know. All of this is just like insane. Like we just have no idea how he got away with it for like so long. Right. But apparently he shouldn't have, because people had reported him to the board before. And
do you know how many people came forward?
We don't even know, but my lawyer said that, like, a lot of people like stated like he assaulted me to the police, and like, I mean, there are so many people. Like it's been 10 years at least of him doing this. Like I think it's been like 8 or maybe like 8 years, something like that, since he got his license. He's like kind of around my age, so yeah.
Oh, so he's young.
He's very young. Yeah, so he was like a young, like, cool doctor who was like, he knew all the new studies. I was like, he's handsome too.
I was picturing like an old man.
I mean, he doesn't look good in his mugshot because like I think they slapped him around and he'd been crying.
So how old was he?
I think he was like 38, maybe.
Wow, okay.
Yeah. So
and how old did you say you were?
At the time, I think I was like 33.
Okay.
Yeah, 32, 33.
Wow.
Yeah. I know. It's just like mind-boggling.
That is nuts. And how old was the Isaiah guy? Was he around the same age?
I actually don't know exactly how old he is. I think he's in his early 30s. Okay. That's kind of what he looks like. Mm-hmm. But yeah, I still don't know that much about what he's up to, other than like he's got himself a girlfriend, and he, he's going to nursing school now. So that, like I said, that tells me like he wasn't licensed before. So like, who the fuck is this guy? Who is he?
And is the doctor you said was married, right? With kids or no?
The doctor is married with kids.
And the wife stayed with him?
Supposedly she's leaving him. I
Okay.
don't know if that like actually happened or not, or they were just hiding assets or whatever,
Right.
you know,
Okay.
because like a lot of us were coming at him civilly for it because like we just wanted to make sure we punished him in every humanly possible
Absolutely.
way, because he's only getting 5 years per person, and then there's like this like credit system in Californian prisons. So even people who have raped people can get significant time reductions with like good behavior and
That
like
is crazy.
contributing to like, you know, a positive prison environment, which he's very good at. Like he's going to do great. You know, he's going to be in protective
Right.
custody the entire time. You know, he's going to just be in his like little cell with his, you know, constant commissary coming in because he's rich as hell. You know, none of his
Wow.
money he got during the, you know, like committing a felony or whatever, like they couldn't take his money away. It wasn't like a money laundering thing. So he still has all that. And so I don't know what he's going to be doing when he gets out, but you know,
Do you know when he's scheduled to get out?
you know, like they said 17 years, but you know, I think they reduced it to 15.
And there's a chance it could keep reducing.
There is a chance it could keep
Okay.
reducing. So that is why I'm like, it's so important to me to make sure that like there's always going to be a record for
Yeah, the
what a
story's out
monster he
there.
is, you know? And it's like, it's so scary to think that, you know, especially for like someone who's neurodivergent like me, like, I mean, that shit just like, it just flies right over my head. You know, I just have like all these different like rationale because like I've learned not to make assumptions. Like I always used to think people were like angry at me or whatever, but they were just like neutral faced because like expressions and all. I constantly did. So like it's, I always have like these, like, I'm like, oh, I shouldn't be making assumptions. Like, so I'll make like, maybe he's just thinking about like something that upset him today or whatever. His mind is somewhere else or he's having a bad day or whatever. Like I would have all these like rationalizations, but it's a very specific look that somebody who, you know, wants to take advantage of you and hurt you has when they're like sizing you up. And like, I couldn't emulate it, but yeah, it's, I'll never forget.
And do you think that the police reached out to previous patients to ask if they had remembered anything? Like, do you think that's how more people came forward, or do you think more people came forward because they heard that this was kind of getting out there?
I think they came forward because it had been on the news
Okay.
and because there had been articles written about it.
Got it.
And you know, I mean, it's somebody who knows them probably was like, "Hey, wasn't your doctor?" And word
Yeah.
gets around, right? So I'm sorry, what were we talking about?
No, you're fine. You answered my question.
Oh, okay.
I was just asking if you thought that the police reached out to his old patients to like see
yeah.
if they experienced anything.
Right. Yeah. So yeah, they didn't do any of that. In fact, the police, you know, I don't have very many nice things to say about them because I wanted to ID Isaiah from day one. And they were like, well, when you first gave your witness, you know, statement, you didn't mention him. And I'm like, okay, I was really stressed out. And I was like, mind fucked that it was my doctor. I didn't even know this guy. I don't know that man. You know, I was so preoccupied with the fact that these people that I had trusted, you know, with my life basically had done this, that I just like forgot to mention Isaiah entirely. And I immediately was like, please let me revise. I forgot to mention him. I know I forgot to mention him. Like, and they would not let me go in to do that. And I said, please, I know what he looks like, this and that. They're like, oh, you don't even think a guy like that works there. And I was like, but he was there. And my mom was like, I saw him. We left messages after messages after messages. And they just ghosted me. Victims Resources, by the way, completely ghosted all of us. They never did a damn thing for us. And that's like our tax money at work, dude. That our taxes are supposed to pay in California for us to like get like psychological care and stuff like that after like a severely traumatic event. And yeah, they don't.
And then what about the women? Did they have any consequences or no? Or did they get off?
Oh, they basically, so Tracy, she still has her license. And as far as I know, she's still practicing. She got civilly spanked though, you know, and I don't know how badly that hurts though, because she's under, you know, she has insurance. So, I mean, she's still walking on sunshine, I'm sure, because she's a woman. So they cared a lot less that she was involved in the rape. And it only happened to me. I was the only one she was involved with extracting information out of specifically, or that mentioned it anyway. And so I guess it wasn't, this is why I didn't go to the police. You see what I'm saying?
Yeah.
Like, it was not important to them that I was raped by another person who was there. It was not, because it was me. Like, if it was one of the, I won't, never mind, let me not describe them. But let's just say that they're, you know, America would care a lot more if they got kidnapped than if I was, right? Yeah. So, like, you know, which they're amazing, by the way. I love you girls. You guys are very kidnappable. You hear that? I love those girls. They're all amazing.
And then you said that you're still in contact, right, with a few of the other victims?
Yeah, one of them I hope she's okay. I think she probably just wants to put this spot behind her forever. But I think the rest of us, like, we're still like processing stuff, and we like,
well,
you know,
it's still fresh.
Yeah, and we talk to one another. Like, all of us have like serious trust issues now. Like, and you know, it's. I mean, I was agoraphobic for like 3 years afterwards, and that's, I don't say that lightly. I saw my best friend twice that entire time throughout those 3 years, and it took like, you know, now like I'm better, but it's like been like it's been a progression, right? Like, it's always like an ordeal for me mentally to like think about going out and like doing something or seeing people or whatever, because things just cost more for me to do, you know, right. Just like emotionally. And like, I know that like for all of us, like, we just feel joy less deeply. We like laugh less often than we used to. I mean, it just like experiencing something like that is just like, so it just breaks you into 1,000 pieces, and you have to put yourself together into a new person.
It also like strips you of every piece of yourself.
Yeah.
I feel like it like takes away all sense of control.
Yes.
And everything.
Yeah. It's like the one thing that you have that's yours is your body. And then, you know, feeling like that it belonged to somebody else without your consent. It's just like, I don't know. Like it's to me like a step down, just like from like outright murder, because like the person who I was before, honestly, for better or worse, I like who I am now. But like, they're gone, like, just, you know, and I had to let you like have to mourn that person that you were, that life that you had before, and the way that you experienced that life before. You go through like a grieving process, and so that was something that, you know, I hadn't done the other times, because I just tried to like bury it. Like, I just was like, you know, like and it's crazy because like I'm so grateful that the Me Too movement happened, because like now people are like, you're so brave, you know, like you're doing the right thing for coming forward, you know, blah, blah, blah. Like that's amazing. That makes me so happy. Cause like back in the day when I had, you know, I brought it onto social media, and I said like, you know, my ex-boss, I, you know, said him by name, you know, like tried to rape me, like da. And people were commenting like, if this really happened, you wouldn't be posting about it on social media. You know, you wouldn't be trying to get attention. I'm like, I want attention on this man's who did this bad thing to me. I want attention on him.
Right. Not
like,
on me.
Yeah. I'm like, I was just there. So, you know, like that was also a problem. And then the time before that, you know, my ex he was a guy in a band that people liked. So he can't do something that's bad. That's something that's still really like an epidemic in like the punk and metal scenes, you know. They're like, oh, that guy's in a band. Like, oh, he might have raped that girl, but like, I don't know, he plays the bass really well. So I'm still going to listen to their band and go to their shows. It's just like, it's like a huge meme within it that like, it's so like, it was so rampant. Like there have been so many times that I've been blackout drunk that like I had quote unquote had sex with somebody that I, you know, didn't remember or whatever, you know, at a party, or like I got like coerced into it, you know, and I didn't even know that these things were sexual assault. Like it was like so normalized too. So like I had like a very, you know, remember my first boyfriend was like a pedophile. So like that was like, I had already had like a very bad precedent for it. And like my parents were like, they didn't have the tools, and for my dad, you know, the willingness to try and like he was like a very like, what were you wearing kind of person. Like, what did you do? Like, you know, you're kind of a slut, like blah. On that note, when I lost my virginity, he was like secretly reading like my AIM, you know, messages. This was back in the dinosaur you know, back in the dinosaur.
We used AIM.
Yeah, AIM baby, and the MSN. Yeah, so he was like a computer genius basically, and he did what's called zombieing a computer, where he had like he could basically just pull up like, you know, my computer screen on his computer, and I had no idea that he was doing that. My mom didn't know he was doing it either. He was just doing it by himself, sitting in his little office, just like watching me like. You know, this is like the time where you're like developing sexually and stuff. And I was like downloading like porn off Kazaa, like, you know, and, like trading it on like, you know, Napster and stuff, you know, like it was like, this was what everybody did, you know, just trading their 8-second videos. And like my dad was watching me do this, which is just like beyond humiliating for so many reasons. But the worst part is he found out when I lost my virginity. He hand typed a letter writing that, you know, I was a huge slut. He was LARPing as my best friend's neighbor. I lost my virginity at her house. He was LARPing to be her neighbor or whatever for some reason, saying that he was, you know, completely taken aback by my whorish behavior, you know, taking advantage of my best friend and having sex at her house or whatever. And it was just like unhinged. It was like 8 paragraphs long, just like basically slut shaming me. And I found it and it was just folded. It was my dad's printer paper in our office, the one that we used for everything. So I immediately recognized it was folded, you know, 3 ways. And I brought it to my mom and I gave it to her and I was just like a mess. And I was like, I don't know who wrote this, you know, and she's like, you know who wrote this. And I was like, yeah, okay. You know, like, and she was like, we need to burn this. We need to burn this and we need to never speak of this again. And I'm like, okay. And that's what we did. We burned it in my courtyard. And so I like always had like a very like distrusting relationship with like sharing like traumas and things like that. Like I always like covered things up with like humor or whatever, you know, to try and like keep it all down there, like, you know, take the piss out of it a little bit so that it wouldn't sting as badly. But it was all like there boiling beneath the surface, you know, like it would have been good probably to have like a better like basis on like what is okay touch and what is like normal behavior, which is why I'm like so like I'm like so adamant about that being part of like sex ed, is like, you know, what's acceptable and what's not acceptable. Consent needs to be like a big, you know, like focus and stuff like that. Because
absolutely,
I didn't even know I could say, you know, no in some of the situations I was in when I was really young, especially. Yeah.
And then going back to the trial,
sure,
were you nervous at all going into that, or did you feel like, okay, I'm ready to speak my story?
It was like a combination of both, right? I mean, because I had gotten so amped up by him coming upstairs and so angry, I was like shaking with like rage, and I was like very worried that I was going to mess up my testimony. And I was like,
and he probably wanted to just throw you all off.
Oh yeah, that was 100% what he did. And you know, but, you know, I listened to some like really like aggressive music and got myself in the headspace that like I was just going to punch him in the face with my mouth. And that's pretty much what I did. As soon as I got up there and I sat down, like my nervousness like kind of drained away, and I just kind of like was really focused on what it was that I had to do. Like it just all went away, I guess.
So did they have each of his victims go through and tell their experience during the trial?
There wasn't actually, so I should back up, I guess. There wasn't exactly a trial.
Okay.
These were like preliminary hearings. We were basically trying to get him to take a deal, you know, because a lot of the victims did not want to go to trial. They did not want to have to explain everything that they went through and give up all of their phone records. And
they'd have to face him, right?
Yeah.
See him? Okay.
Yeah. And I mean, like his lawyer was like trying to do discovery on like complete bullshit, like for complete bullshit reasons, you know, like just because he's a sick fuck and he just wants to know, you know, X, Y, and Z about the victims. Like he's just so sick. And luckily the lawyers, they blocked all of that. You know, they were like, that's not going to happen. You know, the DA also, you know, agreed that it shouldn't happen. So luckily we avoided all of that. But at the same time, I feel remiss that we didn't, because he could have gotten more time. He could have been behind bars for longer. But, you know, like I don't want to, you know, drag anybody through that. And I was very tired too. It had been a long 3 years. Like a lot of us just like it was a constant like roller coaster of emotions too, and you know, him dragging it out as long as possible and them allowing it was all like constantly being slapped in the face, you know.
Yeah, and I think too that's something that you want to put in your past. I don't think it's something that you ever forget.
No.
But I think waiting and waiting and waiting for that day and having it pushed back, it like doesn't allow you to move forward.
No.
Because you know, okay, this isn't solved yet.
Yep.
You know what I mean? And
yep.
So you said he got 17 years?
17 years.
And he lost his license, right?
Yes.
Was there anything else, or that was...
That's it.
Okay.
That's it. Yeah. As far as I know, like he's just, the worst part is that he's a felon and he can't like leave the country, I guess.
But you think he's in protective custody?
Oh, I mean, he's a sex offender. So,
Okay.
I mean, I mean, like, pretty
So is that what they do when you're a sex offender? Wow, okay.
Yep. And I guess it really depends on the state, and it depends on how much they hate you. Sometimes they will release certain prisoners, you know, into the general population, you know, just to be like, bye. But like,
yeah,
you know,
I'm just, I try to keep my opinion out because, you know, but
yeah,
I don't get that.
I don't get it either.
Like, why are you even in jail if
Right.
you're just going to get special treatment?
Well, like regular people.
I don't care what anybody says. It's special treatment.
Right.
If you're
No,
in protective
nobody else
custody.
gets put in PC.
Right.
Like why him? Like people with cancer are in like general population, like much of the time. But like a serial rapist or a pedophile or whatever,
So
they're
the
just
pedophiles
like,
and the child molesters are in protective custody too.
Oh yeah, that's why you're not hearing about them getting murked like morning, noon, and night. Because if they were, they would be gone. People do not like people
As they
who are
should
serving
be.
life. They're like, why? I got nothing to lose, you know. Like so,
Wow.
they're the people who go for them. I can't remember which serial killers it was that got murdered in jail, but yeah,
Wow. I guess in their mind, maybe it's like, oh, we don't want just people murdering each other in jail. But at the same time, it's like,
it happens anyway.
Yeah.
People murder each other.
You get what you get.
Yeah. I mean, like, look, like I'm like, I waffle back and forth between the death penalty, but like, if you know, you asked me, does Leng Ky deserve death? I would say all of them personally do.
Yeah.
They're all scum. They're all absolute freak shows. And
I mean, these people are taking so much away, and I don't even think they realize it.
Yeah.
Because they're selfish and they don't have, I think you said what, empathy? Like they don't have anything. It's empty.
No.
So it's like they don't even realize what they're doing to people that do have all these things.
Right.
They're just stripping them of it.
right.
And it's like that's something that you can't just get back. That doesn't that doesn't go away.
No. There are a lot of people who are like, you know, I actually stopped being friends with somebody who was defending the quote unquote, the right to tell rape jokes. And I was like, bro, like, you know, and I was arguing with him why that's insane and disgusting. And basically he told me like, well, that's a personal problem for you. It sounds like something you just need to go to like a therapist for and like work through. I'm like, bro, it's sure there are some things that's absolutely true about that situation that you should go. Lots of people should go to therapy, but yeah, I think that would be great. But at the same time, there's just like my grandpa had a saying, it's like, you know, you drop a glass on the floor, you can glue it back together, but it's always going to have those cracks.
Yep.
You know, you'll always be able to see those cracks. So,
Well, I think too, joking about something that's blatantly wrong in any circumstance.
yeah.
If we make a joke out of it, then we're saying that it's okay.
Right.
In some way.
Right. That it's not as serious of an issue as it is.
And that's why it keeps happening. Because
Yeah.
there's people like that out there that don't think it's a big deal.
Right.
Unless, you know, of course, if it happened to them,
Right.
things would be different.
Oh yeah. Well, you know, I mean, obviously all of us are just lying about it, you know, for attention, you know, so we
Yeah.
can get Twitter likes or whatever. I don't know. I don't know. I feel like that's like something that I hear all the time. It's like when you say like 1 in 3, you know, women has been raped, like they just like, you know, they just think that like, you know, most of those people are liars, I guess. I don't know.
Right. And it's sad that you even felt like your word wouldn't be taken.
Yeah.
You know, and the fact that, like you said, it may not have been if other victims didn't come forward.
It wouldn't have.
Because it's like they can't. At that point, if so many people are coming forward, they can't really brush it under the rug or ignore it.
Correct.
But if it's only one person, and if it's against somebody that, like you said, has power and that that money, everything, it's like it's almost easier to just, you know, let it go.
Yeah. And I think like too, like, you know, it's just my history of like trying to report it and just being completely blown off, like that just like stays with you. It stays with you, and I'll never trust the police for that reason. Like to me, like the quote unquote good cops that were like showing empathy to me when I was showing my story, like they completely left us all in the dust. Like they just used they used like the nice version of the Reed technique on us, like JCS'd us to get us to give up our stories and give them the information they wanted. And then after that, for them, it was just all about the game of solving the case or whatever. They didn't care about the other details like Isaiah. And, like they were, I wanted to know, like, what are we going to be doing about Tracy? What are we doing about Sonia? What are we doing about Isaiah? They wouldn't even humor us and at least tell me, like, we don't have anything, we can't do anything, like we're trying our best. None of that, like nothing. Like, and I'll never understand why they would not let me come back down there and ID him. Like, I'll never understand. And it's just like, maybe because they think, like I said, because like my mental health history and stuff, like, oh, well, they're not going to be a good witness because of, their mental health
waste
history.
Of time,
right.
Too much work. Yeah.
And I'll just say this. People who are mentally ill don't deserve to be raped or not believed when they, say that they have been. I mean, like, it's just like, it just really is very frustrating.
Absolutely.
And you're just used to it, basically.
Right, which is horrible.
Yeah. Agreed.
It's crazy.
Yeah.
Was there any other points that you wanted to hit?
Let me think. Let me see here.
I feel like you did such a good job, though, too, of like, you went like step by step. It was a really good job.
Oh my God, it was all worth all the typing.
And it was very like, it kept my attention. Like, it was like I was very.
It was gripping.
Yes.
Oh.
No, because it's like because like I know that you said you were worried about like rambling. You didn't at all. Like, it was just very. You did a great job.
Oh, I'm so glad.
Yeah.
I'm so glad. It took a couple seconds to like.
You crushed it. Seriously, you did great.
Awesome.
But I want to make sure that there was nothing else that you wanted to throw in there, add in there.
Just trying to think. I honestly feel like I actually got it. Yeah.
Yeah. You crushed it. I think you did a great job. And honestly, I think that I was just saying this on another episode that when it comes to these people that are in a position of more power, whether it's money or their social status or whatever it may be, a lot of times it seems like it's easier to keep your mouth shut because of people not believing you or because the judgment. Yeah. You know what I mean? Or what people are going to say. Yeah. But I think that's what makes it even more important because it happens so often. It happens, I'm sure, the same amount as it happens to regular people or to like regular people doing it to regular people. Right. So it's like, I feel like this is just an example of why you even should come forward more and speak your story because there's probably so many people that stay hush-hush about things that have happened because it seems safer that way. Right. But you coming on here and sharing your story allows other people to feel heard and not alone. Yeah. And I always say that. And that's so important because I'm sure, even if back when this first happened to you, if there was something that you watched that you were like, wow, like I don't have to feel alone or here's somebody else that experienced something similar.
That's why I contacted you guys actually. It was because I was listening to the stories and I was like, oh my God. I'm like, I love that people who have been through these like insane experiences that actually, normally don't get told, that normally we suffer in silence, know? And it's like, I felt like I could finally like, this is like a release of like a huge burden that has been on my heart because like, it's not something that I can talk to in much detail with a lot of people because it's so heavy. It makes my friends very sad when they hear about this story because it's like so violating. But yeah, like it makes me glad that there's a place that I could do that because it's so hard to do, but it's worth it in the end. Yeah.
I think it's important for you to get it off your chest and I think also say it in a way that you feel is comfortable. Like totally on your,
on your terms.
Yes, exactly. Yeah. But no, I think you did a great job and I'm honored that you wanted to share your story on my podcast. So thank you so much.
Thank you.
like I said, you really, really killed it. You did such a great job. You should be so proud of yourself.
Thank you.
Of course. And I think your story's going to help a lot of people. And I think, like you said, too, the other victims that this happened to, I'm sure that they're going to appreciate this a lot. Because it's almost like you become that voice for them as well.
I was just talking to one actually right before I got here.
Yeah. No, it's like you're a voice for everybody at this point. So that's great. And I definitely agree that this shouldn't be something that just because he is in jail now, that it's not still reminded of like, this is who he is, this is what he did.
Right,
so
exactly.
That's what should happen.
He's really good at like reinventing who he is. So that was something that I really wanted to nip in the bud, because I mean, he's going to find some other field that he can go in and do the exact same thing. Right. So I want to make sure that whoever employs him, this video,
and people know the name,
and they will. And it makes me very, very relieved to know that this is at least something that we can do. Because, you know, like I said, even if the police don't believe you or the police don't care, it's still good to like put it out there to make sure
you have
that
a voice for a reason.
So at least like, you know, sometimes if you just say it and then sadly something else happens, then and they speak up, that just like reinforces this whole event where people like, you know, realize that this person's capable of doing, you know, messed up stuff, and that, you know, the other person wasn't lying. You know, it's happened to multiple people.
I think too, like the more people that come forward in situations like this, the more it makes other people feel and have that courage to do the same. Yeah. And I think that's important too, because it can be, it's terrifying.
Yeah, it is.
And I think, and it's scary, it's terrifying. Nobody wants, even like you said, you don't want to go through the aftermath of having to relive the experience and tell it in detail over and over and over again. Yeah. So it's like people, like I said, they rather just not deal with it. Yeah. But I think that once again, you speaking your story would give a lot of people courage of like, if she can do it, I can do it.
Yeah, it feels really good to do. It does. It feels so good to like just take it out of the hole inside of you and you know, try and like manifest it into something that can, I don't know, have a positive effect. Like that's been like my whole journey this entire time, is trying to like, you know, turn shit into gold essentially. And I feel like I've been doing a really good job at it, and I've been living my best life. You know, they say the best revenge is living well. I still say it's life in prison, but you know, I mean, I'll take what I can get. Right. Yeah. So, I mean, I'm pretty happy about it. I think that, you know, I think it would really bother him knowing how well we're doing.
Right. And knowing that you stood up and said what you wanted to say.
Yeah. Yeah.
So great job.
Thank you so much.
Thank you. I appreciate it. You did a great job. Thank you.